Hi, the topic of my sport injury is fracture rib. But first, let me tell you more about rib. Rib is the long curved bone which form rib cage. For human, we have 12 pair of rib and classified into three types: true ribs, false rib, and also floating ribs. The first 7 set of ribs are true ribs. They are attached to vertebrae at the back and also sternum at the front. The next 3 sets are false ribs. They are same as the true ribs except they share the common cartilaginous connection to the sternum. And the last 2 ribs are floating ribs. As its name, except the vertebrae at the back, it does not attach to anything. The ribs serve to protect the lung, heart, and other internal organs of thorax. Next, fracture is classified into simple and compound fracture. Simple fracture is not obvious as skin has not been ruptured and remain intact. On the other hand, compound fracture break through the skin, exposing bone and causing additional soft tissue injury and possible infection. So, fracture rib is a crack or break in one or more of your rib bones. Not only the fracture of the rib, the soft tissue around the rib might be affected too. Soft tissue of the rib cage include intercostal muscle and the costal cartilage. Common injuries include bruising, the blood vessel rupture and leak blood into the surrounding tissues. Bruising of the chest wall is a common rib trauma. Costochondral separation. The rib is torn loose from the costal cartilage and is detached from the sternum. So, what are the causes of fracture rib? Broken ribs are mostly commonly caused by direct impact, such as contact sport that with heavy tackle like rugby and boxing. Rib also can be fractured by repetitive trauma from sport like golf. Of course, other than sport, the other causes are vehicle accidents, consequences of disease. For example, osteoporosis. Having this disease in which your bones lose their density makes you more susceptible to a bone fracture. Next, a cancerous lesion in ribs. A cancerous lesion can weaken the bone, making it more susceptible to breaks. When things go worse, fracture rib can be more complicated. A broken rib can injure blood vessels and internal organs, and the risk increases with the number of broken ribs. Complications vary depending on which rib break. Possible complications include torn or punctured aorta. A sharp end of a break in one of the first 3 ribs at the top of your rib could rupture your aorta or another major blood vessel. Next, punctured lung. The jagged end of a broken middle ribs can puncture a lung and cause it to collapse. Next is lacerated spleen, liver, or kidney. The bottom 2 ribs rarely fracture because they have more flexibility than the upper and middle ribs. But if you break a lower rib, the broken end can cause a serious damage to your spleen, liver, or kidney. After all, healing takes at least 6 weeks. If you injure other body organs, you may need to stay in the hospital, otherwise you can heal at home. Most people with broken rib do not need surgery. What you can do is do some exercises. First, the shoulder blade squeezes. Begin sitting or standing tall with your back straight, squeezing your shoulder blade together as far as you can go without pain and provided you feel no more than a mild to moderate stretch. Hold for 1 to 2 seconds and repeat 10 times, provided there is no increase in symptoms. Next, deep breathing. Begin sitting or standing tall with your back straight. Breathe in as deeply as possible without increasing symptoms and then relax. Focus on breathing with your lower lungs, not elevating your shoulders. Gently expand your lower ribs. Repeat 5 times. Third, rotation in sitting. Begin sitting tall with your arm across your chest. Keeping your legs still, gently rotate to one side as far as you can go without pain and provided you feel no more than a mild to moderate stretch. Hold for 1 to 2 seconds and repeat 10 times each side, alternating sides, provided the exercise is pain-free. Generally, they should be performed 3 times daily once the physiotherapist has indicated it is safe to do so, and only provided they do not cause or increase symptoms. That's all of my webinar. Thank you for watching and hope you have learned something about fracture rib here.